Hey, this is Dr. Lee Angle with Upper Cervical Health Centers. I'm excited to share with you a new tool and a training system that we have here. So it's called BTS, a Balance Tracking System. So after head injuries, concussions, things like that, sometimes it's a medication, people have had a virus and have had a problem, or just the general aging process, sometimes we start to lose our balance a little bit. We're not as steady as we once were, maybe vertigo, dizziness, things like that. So what this tool allows us to do is two big things. One, it allows us to track and objectively measure that as we go through care and treatment and therapies that the balance is improving. You can see here, here's just a sample. So one of the things we can do is a fall risk assessment, especially in the older population. One of the biggest fears is falling, right? We don't break a hip, we don't want a head injury, things like that. So when we do a test, we're going to get a test, we're going to track the age. It's going to tell us what percentile that is, what the average would be at that age, and it's going to give us a fall risk assessment. So in this sample when we're looking at, right, we've got a very high fall risk here based upon their balanced system. So this would be a post baseline. After we've done some treatment and therapy, we drop down, we've gone from 30 where we're at high risk to the 98th percentile low risk. So that's the way that we would track that. The other thing that we're able to do, so once we get a baseline and we get a measurement, it's going to show us how you moved when we're measuring, and that's going to allow us to do some training that we're going to use off our same system. We know which directions and how to do, so we're going to start to train that balance to improve it. We can run another test so we can measure again, and we make sure that we get especially that fall risk down. And if we're dealing with vertigo and dizziness and general balance, people walking off, we can see that we're improving it and we know what steps to take next.